Do you know the warning signs of stomach cancer? It's a question that may seem daunting, but it's absolutely crucial to answer. Stomach cancer, like many other forms of the disease, can often go unnoticed until it has progressed to a later stage. That's why understanding the warning signs is so vital. It helps in early detection, which can be a game changer in terms of treatment and survival rates. In this video, we'll be going over 8 warning signs of stomach cancer. The purpose? To arm you with knowledge and to raise awareness about this often overlooked disease. From unexplained weight loss to changes in bowel habits, we'll delve into each sign, shedding light on what to look out for. Remember, knowledge is power, and your health is of utmost importance, so stay informed and stay vigilant. Awareness is key to early detection, so let's dive right in. The first warning sign is unexplained weight loss. Now you might be thinking, great, I've been trying to lose a few pounds, but this isn't the kind of weight loss you want. We're talking about sudden, drastic weight loss that happens without any changes to your diet or exercise routine. So, what's the link between stomach cancer and unexplained weight loss? Well, stomach cancer can interfere with your body's ability to absorb nutrients from the food you eat. As a result, even if you're eating the same amount of food as you always have, your body might not be getting the nutrients it needs to maintain your weight. This can lead to significant weight loss that seems to come out of nowhere. Remember, unexplained weight loss doesn't always mean you have stomach cancer. There are many possible causes. But if you've been losing weight without trying, it's essential to consult a healthcare professional. They can help figure out what's going on and guide you on the best next steps. The second warning sign is difficulty swallowing. You may know this condition as dysphagia. It's that uncomfortable sensation where food seems to get stuck in your throat or chest. But how does this relate to stomach cancer? Well, the connection is quite direct. If a tumor develops in your stomach, it can cause a physical obstruction. This blockage makes it hard for food to pass smoothly from your mouth, through your esophagus, and into your stomach. You may feel like you're choking on your food, or it may seem as if your food is coming back up soon after you swallow. It's important to note, though, that difficulty swallowing can be a symptom of other conditions too, like gastroesophageal reflux disease. However, if you notice that your swallowing problems persist or even worsen over time, it's a cause for concern. Difficulty swallowing that persists or worsens should not be ignored. The third warning sign is abdominal pain or discomfort. Stomach cancer, like any other ailment invading our bodies, sends signals. One of these signals may be a persistent pain or discomfort in the belly area. Think of it as your body's own alarm system alerting you that something is off. Now, this pain may not always be consistent. It could come and go, like an unwelcome guest. This intermittent nature can make it easy to dismiss. We've all had those days where our stomachs just don't feel quite right. But it's important to listen to your body's whispers before they become screams. Chronic, persistent discomfort or pain in the stomach area isn't normal. It's your body's way of telling you something might be awry. So if you find yourself frequently battling with abdominal discomfort, it's time to pay attention. Persistent abdominal pain is a sign that something may not be right. The fourth warning sign is feeling full quickly. Now, we've all had those moments when we're just too full to take another bite, but this is different. Stomach cancer can cause a condition known as early satiety, which is when you feel full after consuming a smaller amount of food than you're used to. This happens because as the cancer grows, it can take up space in the stomach, leaving less room for food. The tumor may also cause the stomach to empty more slowly, which can contribute to this feeling of fullness. It's essential to note that feeling full quickly can also be a symptom of other conditions, such as gastroesophageal reflux disease, peptic ulcers, or even stress. However, if you're consistently feeling full after eating only a small amount, and especially if it's accompanied by other symptoms we've discussed, it's time to consult with a healthcare professional. If you consistently feel full after eating only a small amount, it may be a warning sign. The fifth warning sign is chronic nausea and vomiting. Now, we all have those days when we feel a bit off, maybe after a heavy meal or a bout of flu. But when nausea and vomiting become a constant companion, it could be a sign of something more serious. Stomach cancer can sometimes cause persistent feelings of nausea or episodes of vomiting. This happens when the cancerous growth disrupts the normal functioning of the stomach, making it hard for the body to process food the way it should. What's tricky here is that these symptoms can easily be mistaken for other, less serious conditions like food poisoning or a stomach bug. That's why it's crucial to pay attention to your body. If you're frequently feeling nauseous or vomiting for no apparent reason, it might not be just a simple stomach upset. Remember, these symptoms don't necessarily mean you have stomach cancer, but they are a clear signal that something is not right with your body. It's essential to seek medical attention if you're experiencing chronic nausea and vomiting. The sixth warning sign is fatigue. Everyone feels tired from time to time, but if you're feeling a level of exhaustion that's not explained by your daily activities, it might be something to pay attention to. Stomach cancer can lead to a persistent sense of fatigue, a sort of tiredness that doesn't get better with rest. This isn't just about feeling a bit drowsy after a long day. It's a deep-seated weariness that can make even simple tasks feel like climbing a mountain. This happens because your body is using energy to fight off the cancer cells, leaving less for your daily activities. Furthermore, stomach cancer can also lead to loss of appetite and malnutrition, which further depletes your energy reserves. It's like trying to run a car without enough fuel. Remember, unexplained and persistent fatigue isn't normal. It's your body's way of telling you something isn't right. Feeling fatigued for no apparent reason can be a sign of something serious. The seventh warning sign is anemia. Now, anemia is a condition characterized by a lower than normal number of red blood cells. You might wonder, how does stomach cancer tie into this? Well, stomach cancer can lead to anemia in a couple of ways. First, it can cause bleeding in the stomach, which over time can lead to a decrease in red blood cells. Second, some stomach cancers can interfere with the body's ability to absorb iron and vitamin B12, nutrients essential for red blood cell production. So what does anemia feel like? People with anemia often feel fatigued and weak. They can also experience shortness of breath, dizziness, or a pale complexion. If you've been feeling consistently tired and weak, it could be more than just a lack of sleep or overworking yourself. If you're constantly feeling tired and weak, it could be due to anemia, a potential sign of stomach cancer. The last warning sign is changes in bowel habits. Stomach cancer can greatly influence the way your digestive system functions, often leading to noticeable shifts in your bowel movements. This can manifest as chronic constipation or diarrhea, and sometimes a strange combination of both. Imagine your digestive system as a complex highway. When everything is running smoothly, traffic flows well. But when there's a blockage or disruption like stomach cancer, it can cause serious traffic jams, leading to constipation. On the other hand, the same disruption can also create detours, speeding up the traffic and resulting in diarrhea. It's important to note that these changes are not occasional glitches. We all have off days. What we're talking about here are persistent changes that stick around for more than just a few days. It's these lasting changes that should raise a red flag. Changes in bowel habits that persist for more than a few days should be checked out. These are the 8 warning signs of stomach cancer. A quick recap: unexplained weight loss, difficulty swallowing, abdominal pain or discomfort, feeling full quickly, nausea and vomiting, fatigue, anemia, and changes in bowel habits. Each sign on its own may not necessarily point to stomach cancer, but if you are experiencing any combination of these symptoms, it's crucial to consult a healthcare professional. Early detection is a key factor in successfully treating stomach cancer. It's important not to ignore these signs, as they are your body's way of telling you something may be wrong. Your health is a priceless asset, and taking proactive steps to maintain it is a wise investment. If you have any concerns or questions, don't hesitate to reach out to a healthcare provider. Remember, your health is your wealth. For more information, check out the resources in the description below.